middle of March, my symptoms began with an itchy rash on my wrist. And prior to that, I was able to walk 8 miles a day and 40 miles a month easily around Edinburgh. And within 48 hours, I developed an excruciating headache across the top of my head, along with all of the symptoms that we are familiar with now: loss of appetite, smell, taste, hot and cold sweats, vomiting, everything you can think of. And in the space of 10 days, I was missed by my GPs twice. And in all fairness, with the GPs, they didn't know much about it, the same as anyone else. And I tried to dial 999 once, and twice, in fact, and couldn't get through. And eventually, after 10 days, I'd lost 10 pounds in weight, and I reached a point where I could no longer look after myself, and I had to dial 999. And the ambulance drivers, they came shortly afterwards, and they did various tests, and they didn't think that I warranted a hospital admission. And it's no exaggeration to say that I could have died in my bed because tests revealed at the hospital that I had patches of pneumonia on my lungs, dangerous levels of inflammation, and I tested positive for coronavirus. And a few days later, I was considered medically fit to be discharged to manage my own recovery at home. And I had to get a taxi home, and I was seriously ill for 2 weeks afterwards, and flashbacks and nightmares, in addition to the symptoms that we are all familiar with. And it's an experience that I felt compelled to share in a book which I've published on Amazon. It's titled Pandemic, My Story. And more than 3 months down the line now, where we're at seems to have plateaued. Just general fatigue, weakness and aches in my legs. And I've lost the confidence and ability to walk far as a result. And I don't mind saying that I've shed many tears throughout the experience, because it has had a profound effect on my mental and physical well-being. And I've just been left to manage it all by myself, and it has been very difficult.
Oh, Scott, so sad to hear how you're still being affected by COVID-19, even though you are supposed to be recovering. Joining me now is Dr. Sarah Jarvis. So we are hearing what Scott is still going to, even though he should be COVID-free. What are the symptoms that people can still live through after COVID-19? It should have gone, should have ended.
We're seeing a very large number of people who are having long-term symptoms, and in some respects that's kind of not surprising. We know that people who are extremely unwell, if they have certainly the need to go into ITU, the need to be ventilated, they can need to learn to sit up again, to talk again, to eat again, and it can take a good year to get back to normal. However, what we're seeing here are people who didn't have such severe symptoms, and they can still be very profoundly affected by particularly tiredness, as Scott has referred to. And we are very concerned that there's going to be a significant rise in the number of people with ME that we used to call chronic fatigue. So people who've had a viral infection and end up with profound exhaustion, but also gut symptoms, feeling generally achy, shortness of breath, cough, things that come and go. Now, this doesn't seem to be related to an ongoing infection. People don't still seem to be infectious within a few days of their fever going down. But the after effects are absolutely still there.
And Scott, you touched on it a moment ago. Just explain a bit more about the support or lack of support that you've had when it comes to what you've been dealing with, what you've been living with.
Well, about a couple of weeks ago, I rang my surgery to seek some help and advice because I was just struggling mentally and physically with it all. And the receptionists gave me a COVID helpline to ring, which I have done. And they've sent out leaflets by email and post for me to read and to deal with. Last week, I had chest x-rays, which I'm waiting for the results on. And tomorrow morning, I've got to go for blood tests at the surgery. And that's about the level of support I've had since I was discharged from hospital, really.
Dr. Sarah Jarvis, what kind of support do you think there should be? Scott talking about even the mental strain it's taken on him.
Well, there's no question that people who have, for instance, ME, it has a huge psychological impact to be so profoundly affected and to be so unable to function normally. We also know that anybody who's been severely unwell, Scott referred to sort of PTSD-style symptoms of flashbacks. Now, counselling should be available for them. But, of course, we have an NHS which has already been very close to being overwhelmed, and it's very difficult for people to be seen safely face-to-face. So we know that counselling services have been struggling. Physiotherapy, I'm sure, would help him with rehabilitation. We're going to have a lot of people who need the same sort of rehabilitation as they might have, for instance, following a stroke. So whether it's occupational therapy, psychological support, physiotherapy, speech and language therapy, if you're swallowing or your speech has been affected, there are services out there, but unfortunately, we may find going forward there aren't enough of them to go around, given how many people we think are going to be affected long term.
I mean, Dr. Sarah Jarvis, this illness, this disease, it just seems so odd in terms of how it impacts people so differently. It can vary. You can be fit, and it can take a huge toll on you. You can maybe have issues, and you might not have any symptoms. Why is that?
Well, we don't know exactly. We do know that there may be a genetic element to it. We also know that if you have underlying conditions, your body will respond in a different way. But in addition, we know there are different phases of the disease. So, for instance, I'm sure everyone's aware of dexamethasone, this drug which has shown really impressive results in people who are ventilated, people who are very ill with COVID-19. Now, in that case, what it's doing is it's actually suppressing the immune system because the immune system has overreacted, and the overactive attack from the immune system on the virus is damaging the body. So we've got different stages of the disease. We think that people who are of BAME origin are at higher risk of all sorts of complications. We don't know whether the long-term side effects are more likely, but we just know that this is a virus about which we are still learning. We may have come up and be coming down the other side, but still lots to learn.
Indeed. Dr. Sarah Jarvis and Scott Dixon, really good talking to you both. Thank you.